Hi, this is Dr. Stephen Weiner, and I'm going to show you how we treat extremities with Hyperdilute Radiesse as well as the RF microsystem called Genius. And this is our patient today. And we use angled lighting which highlights the cellulite as well as the laxity. And at this point, we are marking out the areas that we are going to treat. It is imperative that the marking is done in a standing position. We then put the patient in a sitting position and we proceed with the injection. The Radiesse is mixed with saline and lidocaine in either a 2 or a 3-to-1 dilution. My preferred cannula is a 23 gauge 70 millimeter easy guide soft fill cannula. The consensus papers state that for every 100 square centimeters, 1 syringe of Radiesse should be used. So in this particular patient, 1 syringe was used per side. The lidocaine that is mixed in the syringe makes this procedure very comfortable and actually makes the following procedure using the RF microneedling even more comfortable too. Care is to do a little feathering of the material outside the marked area to give a more smooth appearance. We are then going to use the ultrasound and show how you can see the Radiesse during injection. Here you see the retrograde injection of the Radiesse in the subcutaneous plane. Here is a second view of a similar injection with a retrograde technique, and you can see the Radiesse fills the subcutaneous fat as well. On this ultrasound view, you show the cannula in a slightly deeper plane, and this isn't the plane that we want to inject, and we didn't inject there. The best results are going to be with the Radiesse injected in the immediate subdermal plane. Here's one last view of a great injection technique in the subcutaneous plane. This is what the leg looks like prior to injection with the subcutaneous fat, and then this is what it looks like after the injection. Immediately after the injection, we proceed with the electronic Genius, which is radiofrequency microneedling, and they have a new body tip which makes this procedure very quick and comfortable for the patient. The injection also includes lidocaine, so this procedure is even more comfortable. You can see that we use the Zimmer cooling to add comfort as well. So this causes a collagen remodeling and collagen stimulation in the dermis, and the Radiesse causes a subcutaneous tissue to also create some collagen. So the effects of this treatment are improvement in the cellulite, improvement in the crepiness of the skin, and as well as some tightening. There is some mild tenderness afterwards and some mild swelling, but there really isn't any significant downtime. We usually recommend 2 to 3 treatments separated by 4 to 6 weeks. Here are the settings that we use for this particular treatment.
Last night I did the Hyperdilute Radiesse and Genius on my upper or lower thighs. So this is 14 hours out from the procedure. Got a little bit of bruising, slightly pink. You can see where we stopped the treatment. But I was able to take a run this morning, do a little bit of light yoga